I want to welcome you to Safety City, which is our injury prevention outreach center through the trauma program at Beaumont Hospital. To the right is Donna Bucciarelli. She is a registered nurse and she runs our injury prevention outreach. And to my left is Dr. Jamie Hope, and she is an emergency medicine physician and also clinical medicine professor at Oakland University William Beaumont School of Medicine. We want to welcome you today for the information we're presenting on behalf of PIRGIM, which is the Public Interest Research Group in Michigan. They are releasing their 30th annual Trouble in Toyland report, where they have a sampling of some unsafe toys that they have found on the shelves over the last year. PIRGIM wants to let us express that this is just a sampling of the toys. It's not an all-inclusive list. There are 4 different categories that are main categories that they are concerned about, and we have a couple of the toys that they found in each category, and we'll go over individually. Those include choking hazards, especially balloons, some toxic chemicals, magnets, which are the high-powered magnets, not just the magnets you found in the refrigerator, and then also some noise concerns that they have about excessively loud toys. So over here we have a couple different things. Small parts are considered anything that fits within this cylinder here. This cylinder is meant to represent a child under the age of 3's fully extended airway. So as you can see, if anything fits in this choke tube, even if it comes a little bit out, then it's okay to be labeled as far as they're concerned for children under the age of 3. But small things that do fit in here, even if they kind of go out the top, they still can occlude the airway. We'll kind of go into the magnets later, but this would be an example of something. As you can see, it just reaches the top, and so this is something that could be marketed and they don't have to use the small parts label. So that's a concern that we have. So the take-home message for this, what we tell parents, since nobody has this at home and really it's not adequate for someone under the age of 3, is we tell them to use a toilet paper roll. So the toilet paper roll, if you're under the age of 3, if it fits through this toilet paper roll, then it is too small for a child under the age of 3. So this is a better idea. That way we won't worry about it closing up their airway. So going on to that, this particular toy, together, this was easily broken off. And as you can see, just using it, putting it into the cylinder, it fits in there. So the concern was that this was easily breakable, and additionally the label was not adequate for a child toy between the ages of 3 and 6. So the Dora Nickelodeon Mermaid Dora, they found through their testing that the arm is easily broken off, and again, this is something that would fit inside the choke tube and be a potential choking hazard for children under the age of 3. Balloons are the most common cause of choking injuries for any toy, and this particular balloon animal kit has inadequate labeling. It also has confusing, misleading labeling. Balloons should be labeled for ages 8 and up, because that is the prime age of choking incidents. And up here they have a 3 and up. Down here they have small parts for 3, but here it has the appropriate 8 and up, so it can be confusing. And we were kind of estimating that maybe because this part would be something for 3 and up, maybe that's why they had the multiple labelings, but they found that that was not appropriate warning enough. There's a separate testing for small balls. Back to the choke tube, this has a diameter of 1.25 inches, but for small balls they find that the adequate testing should be 1.75. So though this doesn't fit in the choke tube, it still is not labeled properly for small balls. And we think the reasoning behind that, and here's the packaging, is because it's not technically a ball, it's a magic towel. So this is why they were concerned. This is how it came when we found it. So on to the toxic chemicals. These are the things that we're very concerned about, because this is nothing that you could test at home like you could with this choke test. But they found this Fun Bubbles which looks kind of fun. Jump rope has chromium, or has, excuse me, a phthalate in it, phthalate DEHP, and the level was 10,000 parts per minute, which is above the 1,000 parts per minute maximum that the regulations have. So what phthalates are something they use to soften plastic. So if you find something that's PVC or plastic, you might be concerned about phthalates being used in the products. So the option would be used to find more natural toys to play with, especially those who would be putting this kind of thing in their mouth, the younger children. And then the Slinky Junior, they found chromium in it, and the chromium contained 1,400 parts per million of this chromium, which chromium that has been found to cause a rash, ulcerations of the skin, and have also been known to cause cancer. We usually have something that they have found with lead in it. This year they did not find any toys through their sampling with lead in it, but the concern is, are they using chromium in place of lead, which is still a concerning health deficit. The magnets are high-powered magnets, and as I demonstrated before, they do fit in this choke cylinder, so they can be marketed for the younger kids. A couple years ago, they were recalling those buckyballs, which were the high-powered magnets, and as of April 2015, the law has passed that these cannot be sold in the U.S. But these, as you can see, are so high-powered, in between my fingers, they still can react to each other. So the concern is, especially when you swallow more than one of these, that if you swallowed them, they can kind of react in the gut and hold off and pinch off the area. So those are extremely dangerous. And as you can see how high powered they are. These aren't just regular refrigerator magnets. And the last category on our list are the noise toys. There's separate regulations based on whether they are to be held to the child's ear, like in a phone. But this kind of toy has been on our list before. It's very loud, and though it's a remote, it looks like a phone, and they are concerned that these very loud toys would be held to the ear and potentially cause hearing deficit or hearing loss. That's something that may not be shown until later down the line, but you can kind of tell. These are very loud, especially if they're going to be held to the child's ears. Some of these do have different levels of loudness. So you might want to consider, if you have children, monitoring that they're on the lower level, or just not buy the loud toys that might be close to their ear and cause something such as the hearing loss. And that's pretty much the sampling of these toys.